I'm Michele Lewis. I'm a gastroenterologist at Mayo Clinic, Florida. We're very excited to be announced as a National Pancreas Foundation Center of Excellence. We have a pancreas center here at Mayo Clinic, Florida, and also in Rochester, and both centers were announced as Centers of Excellence. Centers of Excellence offer patients a special level of care. Patients with pancreatic diseases frequently need a specialty team to take care of them, including advanced endoscopists, interventional radiologists, and specialized pancreatic surgeons, in addition to gastroenterologists with specialized training in pancreatic diseases. When you're seen at Mayo Clinic, Florida or Mayo Clinic, Rochester as a center of excellence designated by the National Pancreas Foundation, you're offered care in a team approach. So you may come in and see a gastroenterologist initially to help make a diagnosis, confirm a diagnosis, or give your local referring physician a second opinion. You're also offered specialty care if needed in the areas of interventional radiology, endoscopy, or surgery. And we work together as a team, frequently reviewing your records together, looking at your x-rays together, reviewing any biopsy reports with our specialized team of pathologists who know more about pancreatic diseases than perhaps other pathologists. The National Pancreas Foundation is a nonprofit organization who really has a goal of caring for patients, distributing information to them, giving them support, and offering them expertise from other patients who have also experienced pancreatic diseases. So when they decided to designate certain centers in the United States as centers of excellence, they really required a high level of expertise in the areas of pancreatic disease, surgery, radiology, pathology, and they looked for centers who could offer that team approach. They looked for centers who had an experience with caring for advanced pancreatic disease and sometimes complex patients. I think it's an excellent opportunity for patients to find centers, perhaps closer to their geographical location, where they can develop a trust and have a sense of faith in their providers. When they go to a center of excellence, they know that the National Pancreas Foundation has already done the background research on that center to establish it as a trustworthy center where they'll make a good diagnosis and offer a high level of care that's expected from the National Pancreas Foundation. There are only 30 centers in the United States that were designated as centers of excellence, so I think this is a great resource for patients to find providers who will offer them a special level of care that they may not be able to receive locally or at other centers where pancreatic diseases are not maybe primarily their focus. Patients who are told they have a problem with their pancreas can be very anxious and nervous about that. It can be a very scary thing. People hear about patients with pancreatic cancer or pancreatitis or pancreatic injury on television, and they read about it in the news, and the things that they can read online can sometimes be very frightening. So it's important for them to be able to trust physicians who have expertise in pancreatic disease to really make a good diagnosis, and then to offer them specialty care to treat their individualized problem, and they need to develop that rapport with a center where they can develop that trust. And the National Pancreas Foundation has done a great job at trying to support that and support patients, and I think that's what they were looking for when they named Centers of Excellence.